Thank you for joining me today for this presentation on communication and interviewing skills. While much of what you will hear today can be used during any healthcare encounter, we will focus on contact investigation interviews where, of course, some health education may be provided. You may also use the accompanying handouts for further information. Please note that the use of patient-centered terminology in the TB field is evolving, and that you may hear multiple terms used to describe persons with TB and those exposed to them. In this presentation, we will use the terms patient and contact. The first part of the session will be about communication skills. We will discuss how to build rapport and effective communication skills and behaviors. Think for a few seconds about what building rapport is. How would you build rapport with a patient? Building rapport is the key to a successful patient and healthcare worker relationship. It is the result of communicating effectively. Rapport is the feeling of trust between people as well as a sympathetic understanding. The patient and healthcare workers are in harmony and have a mutual understanding. This may relate to the objectives of an interview, following beneficial health behaviors, or adhering to a physician or nurse recommendations. We are going to touch upon the following communication skills in this presentation as well as in the course. Everyone has their own communication style. However, these are tips to help ensure that the interview goes well. Interviewers should try to be sincere and natural when using these tips. Our first skill is active listening. Active listening is when a healthcare worker hears what is being said by the patient and pays attention to how it is said so the conversation can be adjusted to elicit the needed response. This includes not only verbal skills, but nonverbal techniques. Some active listening techniques are paraphrasing and summarizing, reflecting, and being silent. Paraphrasing and summarizing are to reword or rephrase a statement to verify information and demonstrate engagement in the conversation. In paraphrasing and summarizing, one might use phrases like, "What I'm hearing is," or "It sounds like you're saying." Essentially, you would not be repeating the patient's exact words. How would you paraphrase the sentence, "I am feeling very tired these days, and the meds mess up my drug use. I don't know if it's all worth it." One way to paraphrase the quote is to say, "It sounds like you're having a problem with your medication." How about this one? A patient says to you, "I can't tell you the names of all my contacts. I just hang out at the pool hall. There's a guy we call Slim, another one named JD. You might say, "I see that it's hard to think of everyone you have been in contact with. Perhaps identifying places you spent time and even just first names is a good start." The next technique is reflection. Reflection is very similar to paraphrasing, but in this instance, emotion is added. In this case, you are acknowledging a patient or contact's feelings, which shows empathy and helps build rapport. This technique helps to check rather than to assume you know what is meant. In using reflection, you would feed back to the patient or contact what you think they have said using words like, "It sounds like you're feeling worried," or "I understand you're having trouble with." In this first example, a patient might say, "I'm feeling tired and this whole interview is making me nervous. You're asking me way too many questions." How would you reflect this statement? One way to reflect this would be to say, "I understand that this interviewing process can be overwhelming." In the second example, a patient might say, "I don't want an AIDS test, an HIV test. I don't want to know if I have AIDS. If there's nothing I can do about it, what's the point in knowing?" You may reflect this quote by saying, "It sounds like the HIV testing process may be scary for you," and go on with further education about why HIV testing is important. Silence can be used to indicate that you are actively listening. It allows the person being interviewed an opportunity to answer questions. Remember, the interview is about them and their contacts, not about how much you know as a healthcare worker. Some people are uncomfortable with silence and will start talking to fill a gap. While silence may be uncomfortable, it may also be an indication of a thought process occurring. Silence may reflect thinking both on the part of the interviewer and the patient. Always be patient and give the person time to gather their thoughts. In addition to being used for active listening, nonverbal communication can set the tone for an interview and is an important aspect of building rapport. Sometimes negative body language can be displayed without knowing it, and this can cause the person to be interviewed not to trust the interviewer. The interviewer should always display appropriate body language as well as be observant of the patient's body language. Eye contact, facial expressions, posture, gestures, and movement and mirroring are all different types of nonverbal communication. They may indicate attentiveness, empathy, boredom, or confusion amongst many other emotions. These are some nonverbal cues that may be displayed during an interview by the patient. Listed here are, of course, just possible meanings and don't necessarily reflect what the person is actually feeling. Culture also often plays an important in body language. Voice and tone are also important parts of communication. What you say is just as important as how you say it. Always use natural volume and tone. If one's voice is too loud, the patient may be intimidated, but if too soft, the message may be inaudible or sound hesitant or lack confidence. Use a regular pace when speaking. Fast speech can indicate a feeling of being rushed, while being too slow can sound tentative. We should avoid medical terminology and jargon when communicating with laypersons, or at a minimum, use these terms with clear explanations. For example, when talking with patients about getting tested for HIV, it is important to be clear about things like lowered immunity or the ability to fight off infections. Be sure to observe the patient's body language for any lack of understanding. As a healthcare worker, you must be confident in your knowledge of TB and are perhaps the first source of information for the patient. Keeping up with changes in the patient's medical record is important. However, if you don't know an answer to a question, it is okay to let the patient know that you will find out the answer and get back to them. Reinforcement is when the healthcare worker provides an affirmation of a positive behavior through both words and gestures. This can include compliment and acknowledging, for example, that a patient has notified their contacts about an exposure as agreed upon, or is going to the clinic for scheduled appointments. The last communication technique is summarizing. This shows that the interviewer is really listening and gives the patient an opportunity to correct information that may have been misunderstood. You may say things like, "We've covered a lot today. In your own words, review for me what we've discussed." Or you might say, "Please tell me what you've heard me say. This will help me provide you with any additional information you need." You should avoid phrases like, "Do you have any questions?" "Do you understand?" These can lead to just one-word answers that don't provide a chance for the patient to show what they've actually understood. Next, we will briefly touch upon some pitfalls in communication. What follows is certainly not a comprehensive list, and you may think of other pitfalls or ways to deal with them. The first pitfall is getting defensive or distant. If a patient is sick, they may feel vulnerable, and asking about their contacts can make things worse for them. Being patient with their questions or lack of understanding or cooperation can assist with making the interview run more smoothly. While you may have a time frame for completing your work, it is key to allow a patient to complete their thoughts. However, at times, an individual may become distracted, so a gentle nudge back to the conversation may be in order. Every patient's experience is different. Therefore, sticking with what is true at the time is important. Making promises to the patient about things like his health outcomes or the confidentiality of information among people who have to know for a need-to-know basis must be avoided, even if you think it may make the patient feel better or cooperate with you. This leads to the next pitfall about personal opinions and advice. Stating things off the record should never be done, such as, "I think you'll have no side effects to your treatment," or "I'm sure your contacts will come in with no problem." We've already touched upon the issues of overpowering the case with regards to speaking loudly or quickly. This may also include behaviors like standing over the patient rather than at their level, or making condescending statements about decisions a patient may have made or their behavior. During contact investigations, there's often a challenge of building rapport and respecting privacy while achieving the main goal, which is to protect the public from TB and to get any contacts tested immediately for TB. It can be difficult to do both. It often requires the interviewer to be assertive. Assertiveness is both a communication skill and a problem-solving skill. In this section, we will talk about assertive, passive, and aggressive behavior. Please keep the following definitions in mind. To be assertive is to maintain one's rights without compromising the rights of others. To be passive is to relinquish one's rights in deference of others. And to be aggressive is to demand one's rights at the expense of others. Think about how you may explain the concept of contact identification in each way. If passive, you may say, when you have an opportunity, it would be helpful to get the names of the people you spent time with. If you're being assertive, you might say, it's important to identify your contacts. Let's start making a list of the people you spent the most time with. And if you're aggressive, you might say, you must give me the names of all your contacts, now. It's clear what the difference is between these three approaches. The first, while polite and respectful, does not give a sense of urgency nor a plan. The aggressive approach is disrespectful and allows for no explanation about why contacts are being elicited. The assertive approach provides a plan, makes the process a collaboration, and gives some background about the contact investigation. The last part of this presentation will cover the very basics of interviewing to lay the foundation for the contact interview questions. Here we will talk about the types of interview questions and effective techniques. A variety of question types will be discussed on the following slides. The interviewer must know when to use the appropriate type of question to promote and encourage discussion with a patient or contact. Closed-ended questions can be used to get a direct answer. They often have a one-worded answer that does not reveal much information. Examples of closed-ended questions are, do you have symptoms of TB? Have you been tested for TB? Or do you live with anyone? How else might you ask these questions so that you can elicit more information? You might say, what symptoms do you have? Or when did your symptoms begin? What tests were done to test for TB? Who lives with you? Open-ended questions allow description and discussion. The reworded questions on the last slide were examples of open-ended questions. A probing question or statement is one that's used to gain more information and can be closed or open-ended. Here are some examples of probing statements. Who are some of the people you have visited in your home or lived with you in the last 3 months? Describe the places you visited in the past 3 months. You mentioned that your aunt came for a visit. Please tell me more about that. Check-in questions are specific and targeted to assess the interviewee's understanding of the information being shared with them. Some examples of check-in questions are here. Why do you think we need to test for your family members for TB? Why is it important for you to take your medicine every day? The first can be asked if you're trying to bring out a discussion about contacts for examination. The second is important if you're trying to provide education on adherence. While every situation is different and may require a different approach, it is generally recommended that you start with open-ended questions and can switch to probing questions for getting more specific information. There are pitfalls to avoid with interview questions. You always ask one question at a time, or at least in groups of two if you are, say, confirming symptoms. As with general communication skills, one should not interrupt. Avoid leading questions like, you don't live with anyone, do you? And finally, rushing and not providing enough time to answer the question is important to gain the best information. In conclusion, appropriate communication and interviewing skills can assist the healthcare worker and patient reach interview objectives in a mutual fashion, demonstrate respect to the patient or contact, and keep the interview flowing smoothly.